Today, we are talking about how to reduce claims leakage in non-par provider networks. We have two fantastic presenters today, Katie Green, Content Strategy Manager, and Dave Servadidio, the Director of Marketing. Between their industry knowledge and experience working with health plans, they really are our health plan dream team. For those of you whose first webinar this is with us, we are Provider Trust, made in Nashville with love. We are a software as a service company that partners with health plans and providers across the nation. We believe that a smarter healthcare makes a safer healthcare, and we do this by monitoring your healthcare populations to identify compliance and credentialing issues before they impact patients. With that, I'm going to turn it over to Dave to go through today's agenda.
Hello, friends. Good afternoon or good morning, depending on where you're at. Super excited for today's presentation. Again, just to follow up on Christina, a couple of things that she took us through too. We'd love for this to be interactive. So to the extent that you've got questions, please ask away. We promise to either answer as many as we can on the call today. This is a quick 30-minute webinar. For any that we do not get to today, we absolutely will make sure we get to follow up with you soon after the session today and redirect you to the right person, whether that's our Chief Compliance Officer or someone else in the organization. So please make this interactive and ask away. We're all here to learn and hope to drive some value along the way. Today's agenda, really quick. We have 4 sections here on the screen. So the first one is understanding the cost of claims leakage. We'll take you through a quick overview of just the growing claims leakage problem for healthcare insurers in the United States. Specifically then, and why you all are on the call and interested today, is the leakage risk in non-PARs and understanding what that looks like and the connections, relationships between claims leakage, government programs, fraud, waste, and abuse, and non-PARs as well. COVID-19 and non-PARs and the relationships and some of the trends that we have seen given our unique positioning in the industry on the relationships between the two. And then lastly is just best practices for managing leakage in non-PARs. We'll lead you with a couple of to-dos, couple of things to take away from today's session. So excited for a good one. With that, let's dive in. The first section we have today is understanding the costs of claims leakage. So claims leakage is big, broad. It's a industry standard term, and it goes well beyond just healthcare. So what drives claims leakage, and really more so to the question of what is claims leakage, and just to anchor to the definition is claims leakage is defined as lost dollars through claims management inefficiencies, ultimately result from failures in existing processes, both manual and automated. That is an industry standard definition of claims leakage across all industries. And you'll notice it's not healthcare specific at that point. And again, when we talk about existing processes, we're really talking about people considerations and process considerations. On the people side, things like fraud, waste, and abuse, which certainly we are an organization that lives in the intersection of fraud, waste, and abuse in healthcare. So we see that all the time. Payment integrity or claims cost management leadership, focusing too heavily on post-pay versus prepay operations from a team management perspective, and then gaps in network management ownership. We will absolutely touch more on this today. From a process consideration, really inefficiencies in claims processing systems and workflows, improper, inaccurate, or ineligible payments, and we'll touch on that quite a bit too. Inadequate issue identification, prepayment, so before you process that claim, inefficient recovery efforts, inadequate technology or vendor management. That is claims leakage at the 40,000 foot view. So then if we go a little bit specifically on the next slide, let's talk healthcare. So the healthcare costs of claims leakage, the costs, we know that this is a growing problem. It's growing. We have seen through our partner and client health plan organizations that it continues to grow as we all navigate COVID-19. Couple of quick just healthcare facts for you. It's estimated that anywhere between $750 million to $1 billion is the annual cost of claim overpayments due to inaccuracy or ineligibility in healthcare for every estimated 18 million members, right? So we have seen that be proved to light as we've started to take a look at different populations and understanding claims analysis versus member and the ratio between them. And that seems to be pretty consistently true. $7 is the estimated cost per claim spent for manual verifications when a claim is inaccurate or unclean, contributing to the higher operational costs for claims processing. And lastly, $200,000 to $300,000 is the health insurer's annual liability due to claims leakage towards state and federal penalties, specifically things like late claim interest payments, performance guarantee payments to plan sponsors. That does not include the simple cost of recovery and to clean and edit claims to make sure they are good for payment too. That is simply just liability that we see. So really I hope that shows the magnitude of the problem a little bit. And just to get really specific, on the next slide shows a case study snapshot. So we say, how much is actually at stake here? This is a case study that we did for one of our partner health plans. It's about 150,000 providers. Outside of that, we looked at a provider network across government programs across 2 states. We looked at 12 months of Medicaid and Medicare claims. We were able to flag nearly 3,000 providers and $14 million in associated claims with quote unquote really good internal built monitoring processes in place that ultimately contributed to the leakage problem. And the last trend, just macroeconomic here, is health plans are spending more to address this problem. Most of you on the call today work at a health plan. You certainly know this well. I won't read through all of the things on the slide, but the macroeconomic trends are on the left and the relation to claims leakage impacts are on the right. I'll note very quickly, just to keep things moving, you will get the copy of the slides either this afternoon or first thing tomorrow. You'll get any of the information presented today. You'll be able to see, so you can reuse and work with on your own too. The macroeconomic trends on the left are simply just, they're known, right? Higher spend on updating existing claims processing systems, rising medical expenses, rising operating expenses, and the higher spend on procuring automated claims analytics and compliance monitoring solutions. And the relations to claims leakage impacts are on the right. Certainly I'm constantly saying the same thing, which is how much is wasted from a dollar's perspective annually on claims inaccuracies. But the last one I'll draw your attention to, which is the majority of insurers failed to improve the accuracy rating in the AMA's assessment report, right? So as it relates to claims leakage and making sure we have good, clean claims data, we're seeing an increased spend from health plans, but are we necessarily seeing the results? And certainly those results vary on a case-by-case basis. So now we've talked claims leakage at a macroeconomic perspective. Katie's actually going to run you through the leakage risk and non-par provider networks specifically.
Thanks, Dave. Sorry, everybody. How's that?
No go. Just for the sake of the call, I'll
okay.
keep.
That's so much better. Sorry, everybody. We're having some audio struggles over here. Let's talk about the provider ecosystem. So as we think about providers in relation to claims leakage, we're really asking that question: or sometimes was that provider eligible to receive payment for XYZ claim? So I like to think about this visual to really compare like why we have such different data for these different populations. So as you know, for your participating providers, answering the question of whether this provider is eligible is fairly straightforward, even if it might require a lot of work depending on your tools and processes. But as this shows, because that provider has gone through these steps of enrollment, contracting, credentialing, you have really a mountain of data and insight about who that provider is and what they are eligible to bill for. But when we look at the flow of non-par providers and their associated data, it gets a lot messier. This is actually a little bit of a simplification because, as you're probably aware, that yellow arrow could come in through a multitude of doors throughout your organization, depending on the line of business or the program, and is probably also flowing through multiple tools and data repositories as well. So because of this lack of data that we often see about non-pars, answering this question can get a lot more complicated. But when we look at how limited the data is, that's where we really start to see a different picture in terms of risk. So how big really is this issue? As we compare sort of par provider populations and non-par provider populations, what we see is a dramatic difference in size. Now, there's obviously a control here for utilization. So you see way more claims per provider for pars than your non-pars. And that population can kind of vary based on your data hygiene practices at your plan as well. But what I don't want us to lose sight of here is that even when we've controlled for the size of those populations, that non-par group rather has about a 2-time risk of an exclusion being within that group than a par provider. And that's obviously very clearly related to the number of hoops that provider record has to jump through in order to get to that network participation. So let's look at what this risk really looks like across your organization. So obviously the end result of this is dollars flowing out the door in terms of claims leakage, but it can take different manifestations across these departments as well. So we know that in the payment integrity area of plans, people feel this very acutely because you're having to chase down those dollars. And that should be no surprise that fraud, waste, and abuse typically comes in at around $270 billion annually. But we know that these recoupment efforts see a lot of challenges and typically only recoup about 16 cents for every dollar. So that's just a lot of money that's going out from that part of the organization. On the provider ops side, we know that ensuring that eligibility is really tough, and there's a lot of just downstream data implications when those processes are inefficient. As we move on to the claims, we see that, of course, the dollars going out the door for ineligible claims. Interoperability provides some challenges when these systems aren't talking to each other, and ultimately we know that impacts the cost of care. And then, of course, just lost time as it takes longer to adjudicate these claims when we have few insights about those providers. Dave, do you want to take us back through some things we've seen recently?
Yeah, so let's talk. We talked non-par providers, and there's one thing that I wanted to anchor us to as well as we continue this conversation is as it relates to your participating provider networks. It's very easy to standardize the process and make sure you have good data in, good data out, really seamless credentialing, really seamless compliance monitoring, and really seamless claims process. And non-pars are just a little weirder, right? There are a lot more ways that a non-par provider, and specifically a non-par claim, can enter your workflow. They essentially, on that slide that Katie went through, the provider ecosystem, is they can enter your ecosystem at various different ways. And so what we find is that COVID-19 has actually made that problem a little bit more acutely felt for our health plan partners. Is we now have more opportunities for non-par providers to enter your provider networks, and more specifically for claims to enter your workflows at an accelerated rate from what you've historically seen, given the fact that we have new methods of care, we're all at home, we're all the different patterns of utilization are really represented in what's entering your claims workflow. And so a little bit more specifically is the challenges that we know you all are facing, because we hear it from y'all on a daily basis, is one, we know that the COVID testing at no cost to members and the degree to which that's been extended or revoked at this point in navigating COVID-19 has represented an influx in non-par claims. Waived pre-authorizations, rapid telehealth expansion, which is here to stay, providers re-entering the workforce and your provider networks and your claims workflows is a big one that we've seen. And then interstate license portability, just to name a few, keeping up with all of the regulations as relates to these non-pars. How do you ensure non-par provider claims accuracy at time of claim to prevent leakage later? That is the core of this message, is how do you identify that this claim from this non-par provider is good to process so that you do not have to go recover later, and it's not contributing to the leakage problem. And so really what we've also seen is the pace of change presents a lot of problems in keeping up with non-par providers. License portability changes at the state board, just as an example, right? We are seeing different licensing boards either extend providers' licenses and the degrees to which those are getting back to quote unquote normal is varying state by state, board by board, as that represents a credential verification as part of your non-par claims validation presents a problem, because all of a sudden these sources are not necessarily behaving like they once did, and the process that you may have in place for ensuring non-par provider eligibility before you process a claim may just simply be harder to keep up with than it once was. On the next slide, when we really see this, and this is the world in which we live in at Provider Trust, so it makes sense to touch on it just briefly, is the opportunity for fraud and abuse. The increased or varied patterns of utilization just puts pressure on existing processes and systems. Example, I just went through the license verification, but your credentialing, how does that play into your non-par provider networks? And specifically as it relates to, if you get that right, how does that address claims leakage? Expanded access, telehealth, and other forms of care delivery. Providers new to this specific type of utilization means you potentially have less data downstream. And then a cash crunch. Dual enrolled Medicare, Medicaid beneficiaries are most likely, we know this, to be treated by an excluded provider. So as folks potentially are losing their employer-sponsored coverage, they are now getting insurance through Medicare, Medicaid. We know that is where fraud, waste, and abuse lives within government programs. We see that all the time. We have plenty of content and plenty of research at Provider Trust to demonstrate that that's true. And we see patient abuse or neglect issues are flying under the radar undetected as it relates to your growing utilization within your government programs and understanding how to prevent leakage, but more directly in this last bullet is keeping members safe as well. So Katie's going to talk about just how one of the ways to reduce claims leakage is to really talk about what does successful monitoring really look like.
Thanks, Dave. All right. So as we look at sort of, go ahead. There we go. At monitoring as a really key solution for reducing that claims leakage, especially within your non-PARs. Our perspective is really that you can see a whole bunch of benefits across your organization that can really elevate your compliance, especially within your government programs, and ultimately serve to keep members safe as you're better able to identify those bad actors, even though you are not in a participating relationship with them. Here, though, we do want to be realistic about what health plans face as they try to move toward this ongoing monitoring of non-PAR populations. And so I wanted to share some of the main challenges that our clients really encounter as they do this. So we know that these volumes are really large, and part of the challenge that brings is in like parsing that data, right? So there's a whole bunch of ways that you can chop it up, and doing some of that like deep dive into the data and really getting it all together in the same place, and then figuring out sort of what your monitoring standards and sources look like is a lot of work. So just getting your arms around that data provides a lot of challenges, and as well as just corralling it from across your organization. And then we have also those multiple entry points that we talked about a little bit earlier. That is another thing to consider as you're collecting this. A big issue that I want to talk about is the lack of ownership. So one thing that we've seen is that really every organization is different in how they end up handling this, and there's not one right answer. But getting to that place where there is somebody, a team, a person who's owning this is really key to solving this problem. So on that front, let's talk about where non-PAR monitoring can and should live. As I said, the good news is that there are a lot of correct answers here, and these are all kind of some possible outcomes. What we know is that there are a lot of people across your organization who need access to the data that is kind of involved in non-PAR monitoring. But depending on how your plan is structured, there's probably better solutions in some of these departments than others. One of the things we find is that if you can tie the solution to a real strategic objective and align this ownership with those objectives, then we'll have a clearer path to success here. Let's talk about some of the data issues that we see here. So one of the hurdles to monitoring non-PARs is really bumping your data up against all of the public access data that is out there about this provider. But how do we work through generating, how do we work to get to results without just generating a ton of manual labor and reconciliation efforts? One of the great things about what is possible is that an MPI really can serve to unlock a whole lot of insights about that provider. And we would love to tell you more about that if you would like to hear how we overcome this. There we go. Let's dive down to a little bit deeper level here and looking at some of the challenges of really getting this insight about these non-PARs. So what we have here is a sample record from a health plan on the left. And this is actually a pretty robust record for a non-PAR. As you can see, we have an MPI number there. And then on the right, we have a real record pulled from a primary source exclusion list. I think this was out of Alabama, maybe. What you notice if you look at this is that there's no real way to know for sure that this Cynthia caterer in your non-PAR network is the Cynthia caterer on the state Medicaid exclusion list. Because they don't report out any MPIs, right? There's not any, this is all of the data that they report out. And furthermore, if we had not summarized the licenses there, you would see that the license number that they did publish out is not one of the license numbers that our client had on record. So that presents a challenge, right? Like, how do we know for sure that this is the same person? Again, just like to tease, we actually can know for sure, and would love to tell you more about that if you would like to hear about it. But let's talk about what some of these best practices for managing leakage can look like. There we go. Okay, so as I said, the first step to solving this problem is defining that ownership. And as with a lot of things, that first step can really be the hardest. Because there are so many constituents across your business, there are multiple correct options here, and getting to that clear understanding across all of the stakeholders of kind of who's on first really is the first and biggest step to implementing monitoring your non-PARs. The next step after that, though, is establishing your best practices. And by this, we really would like to zoom in on the scope of your monitoring. What are you checking? The criteria, what are your standards, and the frequency. So how often are you wanting to collect that snapshot of a provider and under what conditions? And then after you've started to do that, you can move toward eliminating manual verification and automating your workflow. So this step really is crucial for making your teams more effective, moving data through your organization faster, and increasing the precision and accuracy of those decisions that are being made about provider eligibility. And then ultimately, a great solution is also integrated into your existing workflows. The last thing we want to do is end up creating a whole bunch more work for people. So what we really love to focus on is ways to plug monitoring insights into your existing processes, your existing systems, and put results where teams need them, where they're already going to find insights about these populations. And zooming in a little bit here on how non-par monitoring really needs a home. As we said, every health plan ends up tackling this differently. So that work is really just finding the best solution for your organization. Just some of the things, the solutions that we have seen work really well here is rolling it up under that provider network, provider operations, or provider information systems. But obviously there's a lot of people who need a seat at the table, and so getting to that level of data transparency is another really important factor there.
Awesome, thanks, Katie. And just to bring us home a little bit as we start to wrap up, is when we think about claims leakage and how to address that problem and how to get better at this, specifically as it relates to our non-par providers and non-par claims. Step one really is understanding how your organization defines non-pars. What does that mean? Katie mentioned this on the last slide, but when we say what is standard operating procedure for your non-par network, we say three things. We say criteria, scope, and frequency, right? Criteria, scope, and frequency. And that really just means criteria is based on what do you need to know to build the eligibility rules around your non-pars. What is the scope when for every claim that comes in from a unique non-par provider, how long do they stay in your network for, right? So if you see one claim come in, that's what you see on the visual on the right. How long does your organization actually consider that provider a non-par provider? Right? After 12 months, do they then leave your network? Are you managing this to say, is this just getting bigger and bigger and bigger year over year? Or are you actually managing a non-par network, just like you would your participating providers? And the last one is frequency. How often are you checking against your eligibility criteria so that you can better manage the leakage problem? Example, are you doing so on a monthly frequency, on a quarterly frequency, on an annual frequency, or are you doing it every time a claim comes in? On the next slide, you look at this is what we would recommend. Again, you're going to get these slides, so I'd recommend this. Of all the slides we're giving you, this is the one to print out, put on the bulletin board in your office, is to build your monitoring matrix, right? So for your non-pars, what's that volume after you've just defined scope? What's your criteria on the top? And then what's your frequency, which is a source here as well, right? How often are you checking against these sources that contribute to leakage? And when and through what workflow are you checking against these as well? This is the gold slide, right? This is the one that we give away to our clients. We give away to all of our friends to say, gosh, the answer to leakage is complicated and there are a lot of them. One of our points of view is that if you get this right for your non-par provider network, that in itself will help prevent leakage because you'll be understanding scope, criteria, and frequency as it relates to monitoring your non-pars. Inherently, that's going to reduce leakage and recoupment and recovery later. Continuing to go on a little bit, here's just a case study again. I mentioned this at the front, at the very beginning of the presentation, but I'll ask as we slowly click through this slide. Here is a case study that we did. Again, we screened 150,000 unique providers over 2 states in government programs, Medicare and Medicaid, in which we flagged 3,000 providers and $14 million in associated claims. It'll show you the breakout of those. 416 of those and about $2 million were the result of an active exclusion. The 1,600 were an inactive NPI. We looked for opt-out lists, and we looked for invalid NPIs. And just an example of these were all paid processed claims that we were able to analyze over a 12-month period. Within the exclusions, right here, it gets back to the root of what Katie was going at before, but within the exclusions, we looked at current active exclusions, 134 reinstatements and 1 waiver that made up that 1.76 million in claims. Within the exclusions, specifically within the current active exclusions, 171 of those were primary source match. 117 of those were only found given augmented enriched data. So as it relates to non-pars, if you do not have a data enrichment strategy as it relates to your provider data management and keeping up with your directory, If you do not have an enrichment strategy, you will miss things that ultimately are contributing to the leakage problem as claims, again, back to process failure. That's an example of a process failure, is not having a good active data enrichment strategy for your provider network data, and specifically on your non-PARs, to understand, are you enriching non-PARs as a claim comes into your workflow? Are you enriching that with unique identifiers, specifically with NPIs, but also with license information, address information, so that you can prevent leakage downstream? We do, just special for you today, if you're listening to this, you're still on this call, thank you, it's been a pleasure, but we can't help. For those on the call, we offer this just to our health plan friends. We do this from time to time for large provider networks. Is just, we offer a one-time no-cost scrub of your non-PAR provider network. We take a look at claims data, we sign an NDA, we take a look, see what we can find, and potentially even from a consultant's point of view, give you best practices and recommendations. We do this at no cost. We always do it under an NDA. And if that is something that can help either you, your organization, or your specific team, we'd love to connect. So just feel free to reach out to us, and we'll drop you a note as we send the slides up after this call. Certainly, if you haven't heard of us, we have recently launched a product called Dash, which leverages smarter data and monitoring, specifically with provider data enrichment strategies, to greatly reduce the cost of claims leakage for health plans. That's a screenshot of our dashboard on the left. We're really proud of it. This is not a sales call, so we'll continue to move through these slides, but certainly the reason why we understand so much about this is because we do it and prevent leakage every day for health plans. Questions? I think there's only one or two, just in the sake of time. We're already 2 minutes over, so we are going to just keep moving. For those that did come in, we'll make sure we reach out to you sometime today. Just again, if you haven't heard of us, here's a couple of ways to connect. We blog frequently about this topic. We also host webinars at least every other week, if not more frequently. So if this type of content is really helpful for you, certainly there's plenty of it that's all recorded on our website, providertrust.com. That's it, friends. We so appreciate you. Thank you for spending your lunch hour or your morning hour or your afternoon hour with us. It's been an absolute pleasure. We will make sure, for those on the call, that you get a personal connect from us and a personal thank you for joining today's session. And we'll also make sure you get a copy of the recordings from today if you want to rewatch or relearn anything, as well as the slides. So thank you, friends. It's been a pleasure. And with that, we'll go ahead and close it out.
Thanks so much, Dave. Thanks, Katie. If you guys wouldn't mind sticking around and filling out a poll after the webinar ends, it helps us keep our content relevant to you. We appreciate everyone spending their time with Provider Trust today.